our Facebook event co-hosts and some of our partner groups in Connecticut. Those include Quiet Corner Democratic Socialists of America, the Connecticut Working Families Party, One Payer States, the Northeast region of Women for Justice, the Central Connecticut Democratic Socialists of America, Bridgeport Democratic Socialists, Western Connecticut Democratic Socialists, and the Women's March CT group. So thank you all for co-sponsoring this event and helping us to spread the word about it. So we've all been kind of introducing ourselves in the chat with our names, pronouns, the towns we're in, and what brings us out, what makes us passionate about Medicare for All. So feel free to scroll through the chat if you haven't already and acquaint yourselves with the other people on the call. Like I said, this is Medicare for All CT monthly meeting. Medicare for All Connecticut is a grassroots group of people that are agitating around health justice, notably single payer healthcare. That's single payer healthcare at the federal and state levels now, especially at the state level recently, and around expanding healthcare access through things like expanding HUSKY care here in the state of Connecticut to undocumented immigrants and things of that nature. So in terms of recent activities, there's been a lot of organizing around state level single payer bill, which is being sponsored by Representative David Michel, who is, I believe, here. I believe that study on that bill has come out of the committee, if I'm not mistaken. A lot of organizing around expanding HUSKY to undocumented immigrants in Connecticut, like I mentioned. And of course, organizing around local resolutions in our cities and towns to endorse Medicare for All at every level. I know in New Haven, there's an active campaign that has been picking up quite a lot of steam in their Board of Alders. So I think we have some slides or presentation ready. I don't have right now. I don't know if anyone else, Sivan, if you can speak.
Yeah, sorry.
Sure.
Let me get that.
And just in the meantime, we do have a couple guest speakers with us today. We've got Katia Daly, who is an organizer with the CT Students for a Dream. We've also got John Weissman, who is a retired labor organizer and retired coordinator with Western Massachusetts Jobs with Justice. So we'll be talking to them a little bit later. Once we get the introductions clear. So does anyone have any questions up to this point? Is it anybody's first meeting?
I can share my screen if you want, Pete.
Sure, go ahead. Okay, great. Yes, here's some events that we organized back when that was still a thing you could do. There was a town hall at Goodwin College in East Hartford. You can see that on the left there. In the middle was a statewide forum at Whitneyville Cultural Commons, right down the street from where I'm sitting right now. And I'm meeting with Representative Johanna Hayes, who is our only rep in Connecticut, who is a active supporter of Medicare for All, and along with Senator Richard Blumenthal, the only member of our congressional delegation, period, who is a supporter of Medicare for All. So making those connections, building those relationships is something that takes a lot of time. And as you can see, we've been, doing that for quite a while. So next slide.
There we go.
Some more past actions, handing over 17,000 signatures supporting Medicare for All to Senator Chris Murphy, who still does not support Medicare for All. A virtual town hall with Senator Richard Blumenthal, who does, to his credit. And in 2020, just last year, the city of New London passed the first local municipal resolution in the state. And again, that was New London. And then a what was the town that just passed one?
Willimantic.
Willimantic, that's right. Also in over in the eastern part of the state. And like I mentioned, New Haven has picked up quite a bit of steam in terms of organizing around that. And there has been a sort of simmering effort here in Hamden as well. So single payer bills in state legislatures. That's another thing that we've been working on. And they've been spreading, popping up all over the country in here in the Northeast, New York, Pennsylvania, Massachusetts, all over New England, and also along the West Coast, Florida, Iowa, Illinois, Michigan, Ohio, and South Carolina. So this is a spreading movement. These are bills that are being introduced at the local level and fought for, organized around. And there's clearly just growing support for single payer healthcare. Now, if anyone here is not convinced of the benefits of single payer healthcare beyond expanded access and nobody going into medical debt, it's actually cheaper than the current system we have, because it streamlines billing, administration, and all the money that gets spent basically goes straight to care instead of the bloated bureaucracy that we now have to suffer through. And the numbers are all right there in front of you. And this is for the bill in Connecticut, I believe. Some numbers for Medicaid, the sort of closest thing we have to a universal public system for people who can't afford insurance on their own or otherwise don't have access. And just some facts about the difference between a public option, which is something you often see as an alternative to single payer. Usually that's where the government offers a public alternative insurer, but leaves private insurers to their devices in the market. And that really doesn't do much to streamline administration or cut costs in the way single payer does. And it doesn't guarantee care with no premiums, no copays, deductibles, basically no out-of-pocket expenses. Only a single payer system like Medicare for All would do that. So accept no substitute from devious and bad faith public option. So we've been doing a lot of outreach and coordination with other groups around the Connecticut State Single Payer Bill through groups like Connecticut Citizen Action Group, SEIU Connecticut, the Labor Union, the AFL-CIO, Health Equity Solutions, the Universal Healthcare Foundation, and the Connecticut Working Families Party, among others, of course. And here's a quick overview of the bill.
We could probably skip over
yeah,
it.
yeah, we don't have to get into the nitty gritty, but it would basically be a single payer.
Yeah. Sorry.
Covers everything, covers everybody. Those are the two broadest strokes. And there you can see it on the Connecticut General Assembly website. And phone banking around it, the state and local level. So needless to say, people in this group have been busy. Sivan has just shared a screen with a bill overview for SB 1090, which is a bill to study Husky for All single payer. It's not a bill to establish single payer, but a bill to formally study that effort and what it would mean for the state, an economic analysis, and a sort of a close nuts and bolts by the numbers analysis of what single payer would mean for the state, paid for by state money through the Human Services Committee. So that, I believe, just came out of committee, like we talked about. There was a great public testimony that a lot of us participated in. So yeah, some more information about that effort passed the committee on April 1st. So the next step is getting folks to urge their representatives in the General Assembly to vote in favor of it and get that study up and running so we can see those numbers about how much this bill would benefit the state.